Do you have health care? Do you need it? Well, right now, yes, right now, you got the chance to enroll in coverage. See, President Joe Biden required the government health insurance markets to reopen enrollment periods because of coronavirus. And now you have until May 15th to enroll in a health care plan. We know that this is confusing. You got questions about it. So we have three wonderful experts with us today to help navigate the process. Catherine Sevier of the AARP of North Carolina. Morgan Campbell is with the Alliance Insurance Services, and Laura Packard is with Get America Covered. They are all here to answer your questions. If you got one, you can text them to us right now at 336-379-5775. Remember, this is a text-only number. One of the questions that I have heard so far is, can I sign up if I think it might be cheaper than my current plan?
Yes. Yes, absolutely. Right now we are in open enrollment 2.0. We can make changes to our plans. We can buy up, we can buy down. We can even switch carriers right now.
Now, does that include if you have private insurance through your work at the moment?
Insurance through your work is not going to apply to what this open enrollment is. You're going to have your own open enrollment at your work.
So what is this open enrollment? Let's lay it out for people.
So this open enrollment is basically for the folks that didn't get in the first time when we ran open enrollment from November 1st through December 15th. And they just missed that time frame to jump in and purchase health insurance. They now have that opportunity to do that.
We have someone wondering, can I sign up for this if my spouse has health insurance through their work?
Those situations get a little bit tricky. Some employer plans do not allow any dependents to come onto their plan. So that would be, we would need to get the details of the employer plan to see if they allow dependents to come on or not. So that's kind of a specific situation for each person and employer.
And so what does someone do if they have a situation like that? Who can they reach out to for help figuring all this out?
They should first start off with their HR department or anyone who is handling their benefits for that company. And then they're more than welcome to call me and I'll maybe step them through it all every step of the way.
Well, I'm sure they will appreciate that offer. Thank you so much. Someone's wondering, how are the price points set for all of this? Are they cheap?
So that really depends on your income level and what type of plan you're looking to purchase. You always want to pick a plan that's going to fit your needs and what's best going to serve you. We all work off of an income table. So if you fall anywhere between 100 to 400% of the federal poverty level, you qualify for a tax credit or a subsidy to help offset the premium of the plan itself.
And just to be clear, I think I heard you say this earlier, there is no penalty here for changing plans.
Correct. There is no penalty for changing plans. The only thing that I would caution is if you had started meeting some of your deductible or your out-of-pocket max, if you do change plans, you're going to have that money that you've already paid in and it's going to go back to zero when you actually change that plan out.
Laura, I think you were saying something about the cost earlier.
Yes, right now Congress is working on a bill, the American Rescue Plan. And if that gets signed into law, which it might in the next week or so, that's going to change a lot of these numbers. First, it will make it so that no matter how much money you make, you won't have to pay more than 8.5% of your income for your Affordable Care Act policy. So it lifts the cap. In the past, maybe you made a little bit too much money to get help to pay for your insurance, but this will cover everybody, as well as greater subsidies for people that make a little less money, and incentives for North Carolina to expand Medicaid to cover people that are below the poverty line right now. So there could be up to 500,000 North Carolinians could get insured if North Carolina expands Medicaid.
I think that's really something that some people are looking forward to, but it's being debated right now. If that passes, do you have to go sign up again? Or does that automatically just apply to you?
That is a good question, and I don't think people have figured out the mechanics just yet, whether the tax credits will apply instantly. So what you might want to do is hold off for the next couple weeks while all that gets sorted out, because I wouldn't want you to miss out on any tax credits that you could get.
Just make sure to set an alert on your phone so you don't miss the sign up before the end of May 15th, correct?
Absolutely. And also make sure to contact your legislators. If you want them to make healthcare more affordable and available, make sure that they know that.
So we're still getting lots of plans about open enrollment right now. Someone wants to know, can a 19-year-old sign up on their own if they still live at home?
They can. You're going to get into a situation where you probably should consult with a CPA. And if you're going to file that 19-year-old on your tax return, typically the way we work is we look at the household income. So if your 19-year-old is going off to college and they've got an address in Chapel Hill, so to say, that might be a different situation. So I would advise to always check with the CPA first and make sure you have a game plan as to where you're going to actually file that dependent.
We're getting some really good questions in right now. Don't forget you can text yours to 336-379-5775. One that I'm pretty curious about, someone says, my husband's planning on retiring soon, but after open enrollment. Should I go ahead and enroll now?
If the husband is going to be retiring and he's going to be losing the health insurance benefit piece, that actually opens up a special election period. So at that point, he has 60 days from the date that he loses coverage that he can get in without a problem.
This is all very complicated. I'm so glad you three are here to help us through it. We're going to have much more when we get back, including talking about underlying conditions and what that may or may not mean for you signing up. We'll be right back.